Medicaid was created in 1965 as part of President Lyndon B. Johnson's Great Society. The federal government would pay the states to provide free health care to poor people. The main requirement was low income. Move forward 45 years, and as part of the health insurance reform named for him, Barack Obama instructed states to raise the income threshold so that millions more Americans would qualify for Medicaid, trying to help the working poor. Medicaid now covers around 74 million people. But the Trump administration, canceling most of Obamacare, vows to give states more authority to set the rules. 10 states announced they would add a work requirement. To qualify for Medicaid, you'd have to prove you're working if you're physically able, or prove you're searching for a job or in a training program. Some states also plan to require drug testing to prove you're not using illegal drugs.
You can volunteer. If you just 20 hours of volunteer work. It doesn't have to be getting a job. It can be getting education as part of it. It can be childcare.
Trump's health secretary, Alex Azar, spoke last month of perverse incentives under Obamacare that need to be removed. People were deciding not to work, knowing they could use hospitals and doctors for free.
There's no reason they necessarily couldn't be working.
At the Bipartisan Policy Center, Katherine Hayes explains why Republicans demand changes likely to take Medicaid away from a few million people.
They see Medicaid as a welfare program and therefore believe that there should be certain conditions. Democrats, on the other hand, see health insurance and low-income health insurance, for example, in the Medicaid program, as an entitlement that you shouldn't have to earn.
A federal court struck down Kentucky's attempt to add conditions. That's called getting a waiver from the usual nationwide guidelines. But efforts to make Medicaid harder to get won't stop.
We're going to see states, there are a number of states, Arizona, Wisconsin, and others that are coming forward and seeking waivers. So I think this discussion will continue, and I expect to see most of it settled in the courts.
Like so many other issues here in Washington, this is highly partisan. Democrats and Republicans taking entirely different views of Medicaid and other government programs. They see them through different prisms. Dan Raviv, I-24 News at the White House.